AMP2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, welcome to You and Your Doctor, where we teach you how to live a longer and healthier life, sponsored by All County Healthcare. I'm Felice, and I'm subbing today for Lorena Anderson. I am your integrative health and nutrition coach. Today, if you want to call into the show, we're going to talk about health and wellness and learn about our doctors and what they do. If you want to call into the show, it's 888-565-1470. Or if you have any questions after the show, please call Maddie at 954-717-7027. So this is exciting. We're on every Tuesday from 6 to 7 p.m. So we're here today with Tanner Suer. And forgive me if I pronounced that incorrectly, but I think we're good. And you're with KRS Global.
Absolutely.
And that's in Boca Raton.
That is correct.
Right? And I want to hear about what you do. You're the VP of Sales.
Correct.
Right?
Correct. Yes.
And from what I understand, you're a compounding service.
Yeah, well, let's back up a little bit here. I work for KRS Global Biotechnology. We are a 503B human outsourcing facility. Great. And basically what that means is that we follow all the rules and guidelines that the federal government put in place for us to follow. We kind of operate as if we are a full-fledged pharmaceutical, such as Pfizer, Merck, so on and so forth. But since we are still governed by the Board of Pharmacy in Florida, we're still kind of governed by them as well, the Board of Pharmacy. So our rules and guidelines in preparing medication mirrors that more so of a pharmaceutical manufacturer such as Merck and Pfizer.
Yes.
Not so much as your traditional compounding pharmacies. The way the compounding, quote-unquote, compounding pharmacies prepare medication in relation to the way the federal government wants it done now is very, very different. So we're in a transition period in our industry and in the way that we go to make medication. So what that means for everybody out there, if you buy from KRS Global, I can't speak about anybody else out there.
Okay.
But the way that we go and prepare our medication, I put our stuff against anybody else's out there in the industry. Basically, take the Pepsi challenge. I can say so simply because every batch that we make is tested before it leaves house for chemistry and sterility as well. So whatever that vial says, let's just say it's stated at 100 milligrams per ml, it's within a certain amount of the advertised amount. And we're able to provide tangible documentation for every batch. We call it a certificate of analysis. So again, we're able to provide you all the information about that batch of medication to ensure the quality of that product.
Right.
And that's one of the reasons why we are busy as we are today. We're contracted with hospitals, universities, all the way down to wellness centers, ophthalmic, IV infusion centers, you name it.
And individual patients also, yes.
Absolutely. And
I know I was one of them.
Comes down to quality control.
Yes.
So, yeah.
It's amazing. So in other words, you are under a lot of regulations, so it's keeping your quality super high.
Absolutely.
Super high, super clean. I know that
unsurpassed.
At some point, I was a customer through a functional medicine doctor that I was going to for something called the 9AB cocktail.
Vitamin cocktail 9AB.
Yeah,
Great
you
product.
want to talk about what that is a little bit? I know that it really helped me
9AB
with...
is probably our second or third most popular injectable / amino, also known as a lipotropic agent.
Yes.
Vitamin cocktail 9AB is a full B complex. Uses a bioactive available version of B12 called hydroxycobalamin.
Right.
It doesn't contain the generic, cheaper version of cyanocobalamin. The body's got to basically convert that into methylcobalamin, the purest version, to break the blood-brain barrier. Cyanocobalamin, it doesn't get absorbed very well by people with heavy metals in their blood or smokers for that reason. So we use a hydroxycobalamin variant in there as well. Also contains a lipotropic agent. For those who don't know what a lipotropic is,
explain what that is.
It's a fatty emulsifier per se. Let's think about a Dawn soap commercial. You see that greasy pan, the grease all over, it's fat, right?
Yes.
So they take that soap bottle, that Dawn, 2-3 drops on that bad boy, boom, what happens?
Spreads out.
turns into small little fat molecules per se, right? The same thing happens when you inject MIC into the bloodstream. As long as your blood sugar level is stable, your body isn't trying to burn off glucose off its energy.
Right.
Your body is going. Once the 90B is into the bloodstream with the MIC, the lipotropic portion of the product,
Yes.
it's going to start emulsifying those fat cells. But they basically make them smaller.
So let me ask you, does this mean that this is a fat soluble type of
It's not a fat
supplement?
soluble. No, it's emulsifier. Basically, it's going to make those fat cells within the cell itself to be metabolized off as energy smaller. So when the body demands heat, also known as energy, it's going to be transferred through a certain portion of the cell and transferred into the mitochondria more effectively, since the fat cells are much smaller now. They can pass through that doorway more efficiently.
Right.
So that's why the 90B is very, very effective, especially if the patients are on some sort of a low-calorie diet. It helps really cleanse out the liver for the fat cells to be metabolized
I didn't
off
realize
as
it was
energy.
also cleansing out the liver.
Of fat cells, correct.
Okay.
The fatty buildup on the liver,
Yeah.
it tends to really emulsify that, break that down, and be shuttled into the bloodstream to be utilized off its energy.
Excellent. Yeah, I know in my own personal experience, it took about 2 to 3 weeks, I think, to really kick in. And they told me to keep at it.
Absolutely.
I was self-injecting
How were you
once a
injecting
week.
that amount?
It was one full vial, so I filled it up to the number 10.
Okay, so you reconstituted it. Oh, wait.
I reconstituted it
Great. But for
in the
each
big
injection,
fat needle.
the big fat one.
And then, yeah.
Okay,
and
so
then,
were you doing like 1 ml at a time or 3 mLs at a time?
I think it was 3.
Good, okay.
I think it was 3. I had to fill it up to like the number 10.
Correct,
It was a
okay.
skinny needle. They gave me a skinny needle because I was afraid.
I think you were using 1 ml, a 1 ml insulin needle and syringe.
Maybe.
Okay, just so you're aware, moving forward,
Sure.
as you continue on to use the 90B, that product is designed to be administered 3 mLs at a time intramuscular.
It was intramuscular,
Good,
and this was
okay.
under the care of my doctor. This was not something I just walked in off the street with.
Good. Very
And
good.
actually, I have to say, I'm very happy to report that I've graduated. As of this month, I have not needed it anymore, but it really helped during time of fatigue. So, and I have to say that I've walked into your company. You're located right in Boca,
Absolutely.
right off of Clintmore and Congress. And when I walked into KRS, I was dealing with one of your reps, and they were very friendly. They were accommodating. They
Absolutely.
explained everything. So it was a great experience. And, you know, if a functional medicine doctor is recommending it, then I know that we're working with some great people.
Definitely. For those of you out there who are kind of interested in KRS Global, if you were to just YouTube KRS Global Biotechnology, you will see about a 3-minute video of our facility. And those aren't props, those aren't actors, those are all of our employees. That's actually where the medication is prepared and facilitated from out of Boca Raton.
And do you manufacture here in Florida?
Absolutely. We don't like to use the term manufacturer until we are a full-fledged pharmaceutical manufacturer. We
Okay.
like using the word prepare.
Okay. That's where you
Compound kind of was a
prepare.
black eye in the industry for some reason or another. That's for another show.
Okay.
Way too much time on that one. But
Okay.
prepare. Yes,
Okay.
we prepare all the medication in-house here in Boca Raton, Florida.
Excellent. Excellent. And so I'm an individual, but you said that you also work with hospitals, surgery centers. Do you want to talk about it? I think you're national, correct?
Absolutely. Now, actually worldwide. We ship
You're
all over the
worldwide.
world. Absolutely.
So do you ship in bulk, obviously?
Yep, absolutely.
And do you work through doctors, or how do they come to you? How do they find you?
They find us over the internet, believe it or not.
And what is your website?
It's KRSglobal.com.
KRSglobal.com?
You can't miss it. Just Google us, and we're all over the internet.
Okay.
But yeah, we do ship worldwide. You know, anywhere from Afghanistan, New Zealand, Iran. You know, South America, Central America.
Excellent.
We're all over. We're
And
all over.
do people mostly find you through their doctor?
Yeah, it seems as if a lot of the doctors that we're facilitating medication to overseas, they're actually licensed here as well.
Okay.
So they have multiple practices all over the world, and so therefore one thing leads to another. Networking.
Yes.
I started one doctor. Next thing you know, I'm facilitating meds to a hospital in Libya. Next thing you know.
Excellent. So do you find that you're working mostly with functional medicine doctors, or also mainstream doctors? Are you working with health coaches?
We're all over. I mean, anything
Okay.
from sports nutrition to, you know, a podiatrist for even I mean,
a podiatrist.
Yeah,
Okay.
absolutely. Yeah,
And what other kinds of meds do you do? I mean, my experience was this
Wow.
B12 cocktail.
Yeah,
But
believe it or not, we have about 4,000 different line items in our formulary.
okay.
So, I mean, we do anything from any form of injectable B vitamin. That can be one of the 3 variants of B12, a B6, B5, B3, D3, you know, K1.
D3 too.
Absolutely.
People are doing injectable D vitamins.
Yeah, absolutely.
Okay.
For sure.
I know about sublingual. Do you do sublinguals, or everything you do is injectable?
No, we're an injectable company, but we do have some proprietary technology. One of the products that we do is vitamin D3 in an oral dissolvable tablet that gets absorbed through the oral mucosa in the mouth, so therefore it doesn't get really beat up by the stomach acid.
Right.
So
Does it stay under the tongue?
It gets absorbed through the oral mucosa underneath the tongue or the inner linings of the mouth. And the more the medication becomes bioreadily available as compared to ingesting it and swallowing it.
Right, because you lose a lot when it, The one I use is also under the tongue, but I'll have to inquire about these tablets. How long do they take to dissolve?
Depends on which product, anywhere between 15 to, say, 20 seconds. And most of them have a pleasant peppermint taste.
I was just going to ask you about the taste.
We have mastered the masking of the bitterness of some of the products out there.
Excellent. And do you have to take that with food? Because D is usually a fat soluble?
No.
Or it attaches to fat?
It does. Actually, we recommend do not eat or drink anything pre or post administration of the tablet for about 20 minutes.
Okay. And do you use a lot of your products personally? I know that my rep was using the same product that I was using, the 9AB.
Believe it or not.
And he wasn't even suffering from fatigue. He just felt so good with it that he wanted to keep using it, which I thought was kind of funny. But
we have access to the products. I mean, we always have scripts in-house. We all have self-health insurance, so we're also always getting our blood work in the event that somebody wants something or needs a medication prescribed them if they're ill.
Yes.
I'm a needle phobe. Big time.
I was too, but if you need it, then...
You're right. If you need it, it's a different story.
Yeah.
I'm pretty healthy in general. We do have a lot of products that would support people that are very active, athletes.
Yes.
Some exclusive product lines as well. No, I really don't take too much of our orals. I'll take.
Okay.
Okay.
But that's fair enough. It is scary to do the needle. Yeah. I'm a yoga teacher and a meditation teacher also. So one of the biggest purposes of doing yoga or meditation is to use it for other aspects of life.
Sure.
So that's where I used my breathing techniques and focus. Exactly. Breathe deeply. And so if you have other people, you can pass that word on. It definitely helps because I've been very afraid of needles.
I'm taking note here, viewers.
Yeah, exactly. So, and what else do you want people to know about your company and about your product?
Not so much about my company, but all those out there who are using a vendor for other compounds or medication that are prepared. If they have a stability on the product, let's just say it says there's 6 months of the expiration.
Okay.
Do not be afraid to ask for these stability studies for the products out there. We test, like I said previously, we test every single thing we make for, like I said, chemistry all the way down to sterility as well.
Yeah.
And we know that some medications are not stable past 30, 45, 90 days.
Right.
When majority of the industry that we're in currently, they don't have any stability studies supporting the data that's on that vial. So a lot of the time, let's just say they put 180 days on, say, vitamin B6.
Yeah, right.
Well, let's just say that most likely they're injecting pretty much water. It's been oxidized out there.
Really?
So vitamins oxidize very, very, very rapidly. So unless somebody has paid a pretty good amount of money for the stability studies for that product, let's just say more than likely it might be a little substandard for their patients.
So is this due to the manufacturing or the packaging?
Manufacturing primarily. The packaging can definitely alter the expiration as well. Some medications are UV sensitive, so it needs to be in an amber vial.
Right.
Some medications are sensitive to temperature fluctuation or mechanical fluctuation. So more so it's just due to them not really doing their due diligence as far as how to prepare the medication for an extended period of time.
Okay. Okay. Very interesting. Okay, so we talked about your website, and do you want people to contact you personally? Do you mostly deal with the doctors? Or?
Yeah, definitely. I'm also one of the product specialists we have on staff. So if any physicians have any ideas for products that they feel as if their clients or patients, benefit from, they would typically come to me and help start engineering everything, and then I'll take that up the chain to my biochemist.
Okay.
So on and so forth.
So you want them to call you. Your name is Tanner Suer.
Absolutely. You can.
Suer. And do you want to give out your phone number or your
Definitely
email?
Give out my email address. My email address is my name, TANNERSUER @gbtbio.com. That's good boy Tom.
Right.
Bio.com. And also my direct line is 561-430-2379. For all those who may have a large project that you kind of interested in, but maybe a little concerned of the size of the project, us not being able to take on the project at hand, we're fully automated across the board, and the bigger the better. Plain and simple. Like I said, We set up our business model to support hospitals, universities around the country. So if you come to me with an order for 10,000 units, I can knock it out in probably about an hour and a half. And 14 days after that,
In
we'll
an
have
hour
it clear.
and a half.
Yeah, we're fully automated.
Okay.
But the testing takes about 14 to 15 days after that to test for microbes. But besides that, the manufacturing, preparing of the product is only a couple hours long.
Only a couple of hours.
Yep.
It's amazing.
Yep.
Yeah, that's true. They did help me a couple of times in a short time frame, which was very nice. By the way, I wanted to mention that you can watch us. We are live streaming on Facebook right now at allcountyhealthcareinc.com. I didn't mention that earlier, but just in case people wanted to watch this. And I think that's amazing. And call Tanner, 561-430-2379.
Thank you.
Thank you so much for coming. Bioidenticals. Do you do bioidenticals?
Absolutely.
Okay.
7 keto, the bias creams, DHEA, progesterone, you name it.
So bioidentical hormones also.
Absolutely.
So you're working with a lot of gynecologists in the area.
We do.
Excellent. Do you ever put on workshops or
I personally do
networking
not.
events?
No,
Okay.
no, we're actually, we don't do very much networking simply because we are so busy that if we
You
were
don't
to
need
network, we couldn't. Yeah, exactly.
Okay.
Yeah, we're currently expanding
Excellent.
as well.
Well, thank you so much for your
Absolutely.
time.
It's been
It
a
was
pleasure.
excellent to hear, and we'll see you again soon.
you so much.
Thank you so much for helping everybody out.
You got it.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need, and he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home, but if you do, tell your doctor, I want All County Healthcare.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Ready? Hi. Welcome to You and Your Doctor, where we teach you how to live a longer and healthier life. Today, I am filling in for Lorena Anderson. My name is Felice Minkin, and I am your integrative nutrition, health, and wellness coach. We're on 1470 AM and 95.3 FM. We're here from 6 to 7 every Tuesday. If you want to call into the show and ask some questions, we would love it. It's 888-565-1470. And if you think of any questions after the show, I encourage you to call Maddie at 954-717-7027. And we are sponsored by All County Healthcare. Also, if you'd like to watch us on Facebook, we're live streaming right now on allcountyhealthcareinc.com. So today we have Dr. Maxine Hamilton, and thank you for coming on the show and chatting with me for a few minutes. I'm excited to talk to you. You are with Tenant and Tenant Physician Services in Fort Lauderdale, correct?
That's correct.
That's where you are right now. And I know that you've worked with Plantation General Hospital and you're an internist.
Yes.
Right? So you have a whole stream of different health challenges that you work with. And I want to ask you some questions about that today. Sure. And I want to start off with where you've been. It's so interesting when I saw your bio. Are you from Jamaica? I saw that your training was in Jamaica and you were also in New York City.
Yes.
So that's a pretty wide range. And so you've had some amazing experiences under your belt.
Yes, that's true. I was born in Jamaica and grew up there, went to all my schooling there, including medical school.
Yes.
And I graduated in 1982, actually.
Yeah.
That's a long time ago.
That's when I had big hair.
Me too.
You too.
I then moved to New York. My family had already moved to New York, but I begged my mother because I wanted to go to the University of the West Indies. I did not want to leave Jamaica.
Why?
And, well, I just felt that this was my home and this is where I wanted to stay. But, of course, she was my mother, so... Yes. Eventually, I graduated. I could not string it along any further. Right. And so I moved to New York. And I actually wanted to do pediatrics.
Wow. So pediatrics was your first interest.
It was my first interest.
Was that before school or while you were in school?
While I was in school.
Okay.
And I had an opportunity to do internal medicine.
Yes.
And at the last minute, I said yes. And now I cannot stand to hear babies cry.
Oh, my goodness. Do you have children yourself?
Yes, I do.
You do, but you're done with that stage. So once you were done, that's it.
Yes.
Until maybe you'll be a grandma.
Yes,
right.
Exactly.
But then you could give them back, so it's okay.
Oh, yeah.
Right.
Absolutely.
I understand that. So you went from wanting to be in pediatrics, but you had this opportunity, so you said, all right, I'm going for it.
Yes.
And this was in New York City where the opportunity was?
Yes, I was trained at Harlem Hospital in New York City.
Yes.
And it was really an immersion and quite an experience.
Ooh.
And it lives with me today.
Why? Tell me, what was the most impressive thing?
On the one hand, it was really hard.
Yes.
But on the other hand, it was so much experience that you come out almost as, something you put in the fire, like gold or something, and then it comes out to be beautiful jewelry.
Yes.
This, I think, is the kind of training.
Oh, I love that. You're like an alchemist.
Yes.
Changing, metal to gold.
Exactly.
Well, Harlem, it was just New York City was getting cleaned up. That was around the time of Mayor Koch, right?
Correct.
I'm from New Jersey. So,
yes.
And it used to be when we would go into the city, it would be, hold your hand tight, keep your purse under your arm.
Exactly.
It was rough.
It was rough. But Harlem had a reputation. So the residents, when we went for orientation, we were told, you can go, you're safe 1 block north, south, east, or west of the hospital. Ooh. Do not go outside of that. You've heard of Sylvia's in New York. Sylvia's was 2 blocks away. Ooh. So sometimes we would sneak over to
Sylvia's. That is hysterical. You came from Jamaica, which is, pretty laid back.
Laid back. Yeah.
And then so you had the polar opposite. So good for you. You stepped out of your comfort zone, which in a way, you exemplify that to your patients when you're asking them to maybe encounter some kind of healing or a scary disease, that you were the example. In other words, you've lived it. You've put yourself out of your comfort zone and you made it okay. So how do you use that experience when you're treating your patients?
I use it every day.
Every day.
I find that I get a lot of accolades and people tell me how great everything is and so on. But every day I wake up, I feel like this is a new day because I have a lot of empathy for my patients in the sense that I feel what they're going through.
Yes.
Because as you have just pointed out, I've gone through a lot of transitions in my own life, and it might not be of illness,
Doesn't matter.
but it really helps you to transcend
Right.
that area.
Because what I see is that you lived that cliche, feel the fear and do it anyway. So
Correct.
you stepped up and you said, I'm afraid. This is nothing like what I've lived, and I don't really want to do this, but I'm doing it. And then you did
Exactly.
it, and now you're making a difference in people's lives.
That's exactly true. I mean, I remember in my residency, the hardest part was my first winter in New York, and we had a very loud AC unit on the building, but it sounded like a waterfall. And I would close my eyes and pretend I was at Dunn's River Fall, which
I
is
love that.
a waterfall that's very popular in Jamaica.
Yes.
So I use these same techniques when I'm with my patients to try to connect to them and to try to get them to get outside of themselves and to maybe project to an area where it doesn't matter how hard it is, that you can take care of it, you can take care of yourself. It's not the end of the world. This information that I've just given you that you did not really want to hear, I would say what you have to do is to project what, as best as you can, a good outcome for this situation. And I try to do that. Sometimes it works, sometimes it doesn't.
That's okay. Everybody's different.
Right.
What I love that I'm hearing from you is that you don't always see this, first of all, in medical doctors. So you're inspiring to somebody like me who I believe in. There's a place for allopathic medicine and there's a place for homeopathic medicine. I'm a health coach. I'm also a meditation teacher and a yoga teacher. So I'm in a community where there's a lot of people who don't want to go to medical doctors anymore. They've been turned off. But what I'm seeing from you is when you heard that air conditioning and you visualized and saw a waterfall, to me, that's yoga off the mat. That's meditation. That is utilizing the power of your mind, which is the most important thing, because somebody can have a diagnosis and miracles happen. Things can change with the power of your mind. It doesn't always happen, but you can at least make the person's path easier. So it's wonderful that it's coming from you. I was wondering, what illnesses do you see that come in the most to your practice? Because I know these days, what I keep hearing and seeing a lot about is the two big things. Well, of course, weight, diabetes, thyroid, people with low energy. I'm wondering what you see in your practice the most.
I'm sorry. I see a lot of different complaints, but my big area of expertise and interest is diabetes.
I do see a lot of diabetes. I was wondering about that.
An awful lot of diabetes because, I live in a neighborhood or I practice in an area where this is very prevalent. And it's in my own family. I have multiple members of my family that have diabetes. And diabetes actually is one of the things that I personally am afraid of. Because
Why? Why are you afraid of diabetes?
Because it's a disease, at least to date, that we can manage, but we really can't cure. And I sometimes tell my patients, I say, you will go, if it doesn't matter what I do today, and I tell them straight up, I need you to have a hemoglobin A1C less than 7. That's our goal.
Okay.
But
explain to our listeners what that is, because not everybody might know.
Well, the most important number that a diabetic should know is their hemoglobin A1C. Your hemoglobin A1C is the amount of, it's almost like a measure of how much blood sugar has attached itself to the protein part of your red blood cell.
Okay.
So we have done studies and show that not only is that a good measure of how high your blood sugars have been for a period of time, but also it correlates with outcome. So the higher your hemoglobin A1C, the worse the conditions that you'll have. So diabetics have a lot of complications.
Right.
So
let me pause there for a second because
Yeah.
I have a question. So we're talking about the hemoglobin A1C. It should be less than 7.
Yes.
This directly affects your insulin levels. Is this correct?
Well,
Does it directly affect how your insulin can shoot up very high and very low and have a person, sometimes people can pass out. They have side effects that can be very scary.
right.
How does that
Well, the
intertwine?
hemoglobin A1C is really a measure of the blood sugars.
Okay.
And of course, the less insulin you have, the higher your blood sugars are, because insulin
Regulates it.
helps you to dispose of the glucose from your blood.
Right.
So that's the problem is the height of the glucose in the diabetic. Now, sometimes when you're treating the diabetes, as you mentioned, if you would give medications that increases insulin, that causes disposal of the glucose, you may sometimes overshoot and become hypoglycemic. So sometimes you have patients who are reticent. They do not want to take the treatment because they are afraid of the hypoglycemic events.
Do you see this quite often?
Yes.
I mean,
but
people
it's-
who are resistant to taking the medicine because that
Oh,
is-
yes. Absolutely.
You do see this.
And that's why
Okay.
I say I am afraid of diabetes, because we all have to eat and we
Yes.
all like to eat.
Yes.
And it's very difficult because that is the mainstay of managing your diabetes, is to manage your diet.
Right. And that's why what I'm thinking in my head as you say this is about regulating your sugars before you have diabetes. And this is why it's
Oh,
so
yeah.
important to learn about nutrition and balancing your sugars and balancing all of your life, but balancing the way you eat, incorporating healthy fats,
Exactly.
correct? And eating the right kinds of carbs, having half your plate being your vegetables. Do you talk about this in your practice, or is there not really time to go into the nutritional part of it? I know that can take a lot of time.
That is one of my problems, is that when I first started my practice, of course, I wanted to be everything for my patients.
Right.
I wanted to be their nutritionist. I wanted to be their internist. I wanted to be their mother. I wanted to be their sister. I wanted to be their psychologist. But I have been in practice long enough to realize you can't be everything. I learned that very strikingly.
It's very wise.
Because I would sit and spend, 20 minutes giving a whole dissertation about diet and exercise, and nothing would happen for the patient. And then I would say, I'm so fed up with you now. I am going to send you to a nutritionist. The next visit, the patient comes and they are telling me, "Doctor, did you know that this orange cause?" I'm like, "Oh, honestly, I've been sitting here for months trying to get you to understand that." So I quickly learned that people hear when they're ready to hear.
Yes. The teacher comes when the student's ready, right?
Yes. So me trying to
Yeah.
force it is not going to be
Well,
helpful.
it's kind of like being a mother, right? Like you said, you want to be their mother, and you're giving them the medical, which you need to. That's your expertise. Well, growing up, didn't our mothers always say to us, "I've been telling you that. How come you don't listen to me?" Right? So it's kind of, you're the doctor, you're the authority figure, and people get very nervous, especially when they're getting a diagnosis. I think the brain can only take in a certain amount at a time. So it makes sense to me. It also shows me that you're wise, because all the greatest managers, and you are a manager, you're a doctor, you're running a practice, which is a business, and you need to make sure you're giving your best to each patient. So you're saying, okay, let me let the people who do what they do
Exactly.
best do theirs, and then everybody's at their optimal. I have that in my experience too. I'm a health coach, so I help doctors where they don't have the time to sit one-on-one with the patients. So it's very interesting. So diabetes, is that, I would say, the number one prevalent issue that you're seeing with the people that you're getting? And are the people that you're getting all in South Florida, or do you also work with people virtually?
No, as of today, I only do face-to-face visits in my practice. I also do admit patients to the hospitals that I go to, and because I really I like all of it. I like being there and the continuity of care, and I've had patients that have been my patients now for like 25 years.
Wow!
So I like that, but at the same time, I like the adrenaline of going to the hospital and taking care of the patients, so that I experience the full continuum of care.
Right.
So it's personal for me to be able to do that, and it also is helpful. And I actually went to medical school back in the day when doctors wanted to be that person and didn't want the care to be fragmented. So basically, since I'm an internist and I'm not a specialist, I feel like primary care should mean primary care.
Yes.
And that I am that person who should be there when you get sick and you go to the hospital and you're frightened, and I want for you to open your eyes and you see, oh, there's that person who is going to help me through this. Even as I don't do colonoscopies, I don't do endoscopies, I don't do cardiac catheterization, I don't do I don't do surgery.
Okay.
But I want to be there for
But
my
you're there,
patients.
and so this is why people stay with you for 25 years. I want to let people know how to get in touch with you.
Yes.
So do you want to give a website, a phone number, or an email?
Yes. Unfortunately, I don't have all of my information, but my phone number for my office is 954-463-3804. It's in Fort Lauderdale.
Okay.
1330 Southeast 4th Avenue, Suite B and C.
Excellent.
And I have I've been a physician for all this time, but I've recently joined with Tenant Physician Services because I feel like being in a group, and now I've been by myself a long time, being in a group with a very reputable group, that this will serve me better and allow me to be the kind of physician that I've always wanted to be.
I love it. I love it. So you're in Fort Lauderdale at Tenet Healthcare, and it's 954, and tell me the phone number one more time.
463 3804.
3804. And one last question for you. Are you still teaching? I have in your announcement
Yes, I do. I have been part of a residency program for the last 20 years. I like very much to teach. Unfortunately, it does also take a lot of time. And so I mentor students from Nova Southeastern,
Oh, excellent.
as well as participate in the programs, residency programs.
Well, excellent. Thank you, Dr. Maxine Hamilton, for coming here. It was such a pleasure to talk with you. And please call Dr. Hamilton at Tenet Healthcare in Fort Lauderdale, 954
463 3804.
3804. Thank you so much.
Thank you.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your all-county healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Better? Hi. Welcome to the show. We're here with Dr. Mannish Gupta.
Yeah, it's Mannish.
Mannish
it's okay.
Gupta.
Close enough.
I keep doing that. Mannish Gupta. Well, this is You and Your Doctor, where we teach you how to live a longer and healthier life. I'm here filling in for Lorena Anderson, and my name is Felice Minkin. I am an integrative nutrition, health, and wellness coach, and we're here every Tuesday from 6 to 7. We're on 1470 AM and 95.3 FM. So we would love for you to call into the show today with any questions or comments, 888-565-1470. And if you think of any questions from any of our three guests, please call after the show at 954-717-7027. That's Maddie. So you'll be calling Maddie after the show. And we want to thank All County Healthcare for sponsoring us today. And so I'm excited to talk to Dr. Mannish Gupta.
Same here. Look forward to it.
Thank you. So why don't you tell us a little bit about what you do? I know that you specialize in sports medicine and joint reconstruction, and you mostly focus on hip, shoulder, and knee, correct?
Well, yeah, that's my career, but I do a lot more than just my career.
Good. I love that answer. You are not your career. And you're a guy and you say that. So that usually we have to have men in therapy to figure that out. So
that's okay.
This is great. But I can tell that we spoke a little bit earlier, and you love what you do, and you have a full spectrum view on health. I'm an integrative nutrition health coach, and Dr. Gupta considers himself an integrative doctor, which means that we're not just all about giving pills or having an operation. We're talking about how we live, how we eat, how we relate to people, creating happiness, having rest.
Yeah,
right?
I totally agree.
The full spectrum.
Yeah, I totally agree with that. Partly because I think I've grown up in two cultures. You know,
that's
right. I was born in India and raised in America, and being an Indian, coming from a small village, you're not always going to rush to the hospital or find a doctor to treat everything. So you learn a lot of the home remedies, and India is so full of culture in the art of healing. From Ayurvedic medicine to non-operative means to take care of a lot of ailments, and a lot of it stemmed down from many, many thousands of years. So having that background, and then obviously studying in the States and being trained and in a surgical specialty like orthopedics, and then on top of that being a sports doctor, so where performance and healthy living and motivation to go back to what you do and what you like to do is paramount. Not just for $1 million athletes, but for everyday athletes like you and me.
I was just I was wondering about that. Do you only work with athletes, or do you work with people that maybe just need a knee replacement?
Well, no, for me, everyone's an athlete.
Okay.
I always say that to my patients, and when they walk in. So if I have a 85-year-old patient and I'm interviewing that patient as to what's wrong with them, one of the first things I ask them is, "What are your goals?" And they may just say, "I simply want to get up from a chair and walk without pain."
Yes.
To me, that's an athletic endeavor.
I love that.
They want to take care of themselves.
That's right.
They want to be better. They want to be pain-free. And that's the same kind of question, same answer. The answer may be different. Just today I had an athlete who got hurt and has got aspirations to play in the baseball professional as a professional one day, and injured. And I said, "What's your goal?" He's like, "Well, I want to be drafted." So,
I love that.
You got to just take care of the patient that's that comes to you.
Yes. And what you're saying is when you ask people, what are your goals? You're asking people, what is their why? And when you know your why, it gives you more of a drive and to stay consistent, to take the steps, even if it's difficult.
Absolutely.
Because you know your why.
Absolutely. Because, even as a surgeon, people often ask me, are you just a surgeon that operates? And I don't think that's a complete answer, because a lot of my patients don't want to be treated, under the knife. And so we've got to be able to gain confidence, and sometimes surgery is the last resort, and a lot of times in the way I approach things. So when you say I'm a shoulder, hip, and knee specialist, I think I'm more than that. I treat orthopedic injuries, so that could be from the spine to hand, foot, and ankle. But yeah, there's areas that I like to do which are related to the hip, knee, foot, and ankle. I mean, hip, knee, and shoulder. But as far as being a orthopedic surgeon or physician, I believe I'm a physician first.
I love
that.
that.
That means listening to patients, making sure that I address their problems and what they're there to be seen, rather than what I'm just good at and being trained. So.
Right. So you're treating the whole person.
Absolutely.
So essentially, I know you don't advertise yourself as a holistic doctor, but I would say holistic with a W, because you're treating the whole person.
Right. I think, the connotation that you get from a holistic versus...
Meaning herbs only. And,
right.
Right. But you have a nice mixture of allopathic and homeopathic. In other words, I know that you were brought up with Ayurveda, and I'm very familiar with them. They're one of the oldest types of
disciplines
in the world.
Yeah.
That and Chinese medicine. I don't know which one is older, but more than 5,000 years.
I think we'll get a lot of arguments if we try to figure that out.
Yes. So we won't even go there. But we know that they're both old and wise, and a lot of their concepts are overlapping. And I'm a big follower of Deepak Chopra, and he has followed a similar path to you. He was born in India. His family also, same thing. When I listened to him interviewed, he mentions that he had a lot of resistance to following Ayurvedic medicine in the beginning of his career. And then later on, he opened back up to his heritage, and he mixed both. And I was wondering, did you ever go through anything like that where you felt a resistance because you were in medical school and you were everything that you were learning? Did you ever feel that there wasn't a place for Ayurveda, or did you always keep that with you throughout your path?
Well, I think you always question it, because, when you're going through things that you learn at home or learn by osmosis, you always question that.
Is it true? Is it real?
Exactly. It's coming from your mom or your dad, your aunts and uncles. And then, going through the philosophy of going through allopathic school in the United States, it's evidence-based medicine, which I think is very important as well.
Yes, it is.
And so that gave me that opportunity to be, more scientific. Have a problem, you state the problem, you have a hypothesis, you do the research, and you find an answer. And certainly those are proven and tried techniques. But I think where it was a balance for me was when I couldn't answer all those questions from the allopathic standpoint.
And when did you figure that out? Did you figure that out while you were in medical school or while you were in your practice?
Well, I think more in my practice than in medical school, because I think in medical school you're so coached. You're just trying to get through the body of work, learn it well,
right.
Do well at it. And then, going through training and everything, you have mentors who may not be open to those things. So
is it really a lot like ER?
Besides the jumping around in bed,
Okay.
I don't know exactly how that works, but it probably happens behind closed doors.
Right,
anyway.
night, yeah.
But
it looks like no sleep for 7 years or whatnot.
Well, I do remember a lot of sleepless nights. In the ER when I was a resident. The 80-hour work rule didn't really apply to the small program that I trained at.
Okay.
I was quite busy. But going back to my point was that when I got out on my own and had to deal with all the problems, that came, in terms of patients. That's when I started thinking is that there are not a lot of answers all the time. You have to try to be a healer, and the art of healing or the art of medicine encompasses how you portray yourself in front of your patients. And luckily, I've been exposed to something a little bit different. So, and I think that attracted some patients to me. and they find the confidence that I'm not going to be the surgeon that only says there's only one answer, and
Yes.
truly do give them, if they need that surgery, that's the answer they get. So there's a lot of trust that goes with it, and I find that like I'll give you an example. In my practice now, we use a lot of anti-inflammatories to help with pain and inflammation.
Right.
But the medicines that we often prescribe have side effects to them.
Yes.
And they become just as detrimental. And we find patients are hooked on narcotics for pain control or anti-inflammatories where they can have issues with bleeding and even related to some changes in cancer and stuff. So that's when I found that some holistic approach or Ayurvedic medicine has done some really interesting results where we use anti-inflammatory natural products that
For instance, like turmeric
and curcumin and other things. So, and that's based on research as well. I went through the whole process, and where we actually did some scientific research projects based on those substances, and we found the answer we were looking for. So going through the process, but being exposed, I found that I was able to get some answers that.
That's amazing. So how do you determine, or maybe I should ask you, what do you do? What do you recommend first? And I have a two-part question. My brain is going really fast. One is, do you find that more people are accepting of these types of treatments, like turmeric, curcumin, or are you finding more people are just wanting the prescription, or do you feel it out per patient?
Yeah, well, actually, a lot of it's already done for you because patients, because of the internet and the ability for them to get all this information, they come to you with those, questions and often the answers. They just want to look for guidance and saying, are they thinking what they're thinking? Is it appropriate? Is it right? And certainly, I'm not going to hear and tell you that they're the solution to everything.
No, but I'm just wondering if more people are resistant to it, or are they becoming more open to?
No, they're definitely more open to it.
They're more open.
They're definitely more open to it, and I find that more and more.
And you've been practicing a long time. How long?
About 10 years now.
About 10 years.
Yeah.
So do you see a difference from 10 years ago till now in people's reactions?
My first year in practice, I probably wouldn't. And I had a small practice because I started my own practice.
Sure.
And probably would not have seen that curiosity. But now, in the last 2 years, I've just seen a plethora of patients just wanting
more natural ways.
More natural ways, and yes, absolutely.
And we'll talk a little bit more about that, and then I will ask you about your robotic surgery, because I know that you're doing that also. But I wonder, do you also tell people about... I think that you might practice yoga. Do you do a lot of stuff that on your own? Do you share that with your patients, what you do in your personal life, and act as the example, or do you kind of keep that to yourself?
Well, I think it's a good question, because if I couldn't live and experience what I want my patients to, it would be hard to recommend that. So
right, and it does happen.
If I tell my patients to lose 30 pounds when
right.
I'm not doing it or something like that, it would become a little bit difficult.
Yeah.
I try to lead
practice
a healthy
what you preach.
Lifestyle. I probably don't practice as much yoga as I should.
Doesn't matter.
But certainly I do it customarily. My father is big into it, and
excellent.
And more for my stress management. For
right.
my own sanity, it's important. And but I often tell my patients the same thing, and and they are able to catch on a little bit.
Well, you're the type of doctor that I would want to go to or send my grandma to. But we're almost out of time, so I want to just come to your robotic surgery. Tell me a little bit about that. Who is the biggest
here's the
proponent
thing.
for it?
One of the things that I truly believe is that technology needs to be married with advancements in medicine.
Yes.
And robotics gives me a chance to be more precise and be more accurate with my surgeries. And actually, on May 4th, we're having a big seminar. If everybody wants to come, it's at 6:30 at the Boca Library. We're going to be doing it where we're doing robotic surgery in the ASC. And this is for partial knee and total knee replacements in the future. So again, it's just marrying technology.
What time is it at?
6:30.
6:30.
You can go to my website, www.sportsorthocenter.com, and then, obviously get the information. But again, it's, I try to tell myself that I need to be at the forefront of providing good care.
Excellent. Okay, so if you want to find out more about Dr. Gupta, www.sportsorthocenter.com. And the phone number is, what is
561
561
314 7200.
72. Thank you so much for coming. And thank you for joining us today at You and Your Doctor, where we teach you how to live a longer and healthier life. We'll be here again next week, Tuesday from 6 to 7 p.m. And again, if you have any questions about today's show or want information about Dr. Gupta's workshop, please call Maddie at All County Healthcare at 954-717-7027. Thank you so much.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next